Thank you for tuning in Global Elite Consultant and Global Elite Academy. We're going to talk about how to start a non-medical home care agency in Texas. You must obtain a home and community support service agency license with the personal assistant service category from the Texas Health and Human Services Commission. A personal assistant service category covers non-medical service such as bathing, dressing, meal preparation, companion, and light housekeeping. So you're going to create or form your structure, LLC or corporation, with the Texas Secretary of State. Obtain your EIN number from the Internal Revenue at irs.gov, and then you can fill it out right online there, and they'll give you your number right online. Obtain and open a business account. You have to obtain general liability, workman's comp, and professional, business insurance. You have to appoint an administrator, and Texas requires, like Colorado, an administrator and an alternative administrator. These individuals must meet the qualification requirement under Texas regulation. I will put the website under your notes so that you could go in and read that yourself, what Texas requires. Okay. You have to, there's a training program called the CBT that the state requires that you take. It's a computer-based pre-survey training. Before you apply, you have to take this. You will upload the certification with your application. I'll give you that information too in the notes. You're going to need your policy and procedure manual. We can help you with that. And then you're going to go to the website, which I'll put that in the notes, to where you submit your application. Then you're going to pay the state fee when you upload the application. The current state fee for the licenses in Texas is $2,625, and that's for a 3-year license term. So I guess in Texas, they license you every 3 years, and then you have to, in every 3 years, then you have to reapply again, get a renewal, and it's every 3 years. That's pretty good. And Colorado is every year, and some states is every year. Some states do have every 2 years, but that's pretty good every 3 years. You have to complete a background check for yourself, the alternative manager, and all of your caregivers. They're going to have a background check. There's going to be an on-site survey after you fill out your application. The state will contact you and let you know when they're going to come out to do a site survey. And what they're going to do is go through your policy and procedure manual, make sure that's correct. They're going to look and make sure you have a file cabinet that locks. And they're going to look and make sure you understand your compliance laws, because they may simply ask you a couple of compliance laws, and then you will have to answer them. That's the survey they come out and do. And then they may do that on the computer, because it just depends. Sometimes they do it on the computer, and then they come out to do the survey, and that one is to for you to for them to see about the locked file cabinet, as well as do you have it posted what time your office open and what time your office closed, because that needs to be posted in visible sight so that people could see. So they might come out separately for that, and then just do the survey over the computer as far as your compliance. And they might tell you to let them see your emergency your emergency evacuation policy and procedure. They might just ask you to let them see, and they want to see a couple of them to make sure you're in compliance. You have to obtain, I don't know if I said this, but your insurance, all type of your insurance, your scheduling software, the software for your caregivers to be able to clock in and out, caregivers file, your intake forms for the patients, service agreements for the patients, your payroll system. You're going to have to set all that up. You're going to do your marketing, because you can't get patients, like I was just saying, without marketing. You have to do marketing to get patients. You want to get in some of the online directories, Google Business Profile. You want to get in there, and you want to be able to, get some clinics and doctors' offices that you can market to. No marketing, no patients. You have to market. Okay. Okay. And then I'll put it in the link. There's a website on how to become a licensed provider, and I'll put that in the link so you can read that. Now, if you needed our help, we offer a consulting package. For example, if you, a typical startup package would be the formation of the structure of your business, which is the LLC or the corporation. We can help you get your EIN number. We'll help you with the application for Texas to apply for the license. We'll also help you with your policy and procedure manuals. We'll make that up and give it to you. We'll help you with if your administrator needs some type of training before it started. We'll help you set that up. Website set up, professional business email, we set it up. Marketing material, we give you 2 to 4 months of training. And then we give you 1 year of consultation support. And there's much, much more in that package. Our package for Texas runs $15,500. You can pay half down, and the rest you could do on monthly payments. That includes the fee of your license too. It includes all of your fees, your startup fee. Because like I said, the license for Texas was $2,600 and some change. So when you pay us our fee, we will pay that out. We'll pay that $2,600 out of. It's included, in other words, in that $15,000. It's included in there. Also, IHSS is usually a fee too. In Colorado, if you want to get that, sign up for that. In Colorado, it's I think it's $730. It goes up every year. Every state is different, but it's going to be about $600 or $700. That rate is also included in our package. There's much more included in our package, but if you're interested, just drop me an email and I can send you a proposal, or you could call and ask any additional questions or ask about our packages and we can help you. Okay. Okay, so that's what you would need to be able to open up a non-medical home care agency. And again, a non-medical agency does services like bathing, dressing, grooming, meal preparation, light housekeeping, and medication reminder. Now, some people always ask us, is transportation included? We call it running errands. You know, if the patient has errands, we don't necessarily call it like transportation, because transportation, when you offer like transportations, usually they have to be licensed by the state, and it's just the wording that you use that would, if you, like if you provide errands, taking them to the grocery store, taking them to doctor's appointments, you don't have to get special license for that. The caregiver can transport the patient in her car or either their car. But if you say you provide transportation services, when you say it like that, it has to be licensed. And we do not do transportation service under that classification. It's all about the wording. But yes, we do errands. So we will take them to the doctor and stuff like that. The difference is, it's really the same thing, because the difference is let's put it like this. If you called and you said had a doctor's appointment and you wanted a transporting company to come take you to a doctor's appointment, the transporting service had to be licensed for that or certification for that. But if you hire a caregiver and say, well, I need errands ran, it includes taking her to the doctor's office. You don't have to have a license for that. You understand? It's just the way you word it. Transportation, you have to have a license. Running errands, you don't. Okay? Okay, so I'm going to do another video on the Medicaid waiver program. And that's if you are low income and you need to get care. In Texas, the Medicaid pays for community-based program to keep your loved ones at home, and they pay for service while they're at home getting care. So if you want to be an agency that provides caregivers for low-income people who need care at home, our next video we're going to do is going to show you how to apply for that so that your agency can take those type of patients. If you don't apply for that, then your patients will only be able to take private pay, and that's pretty much it. So I'm going to make another audio about that, and you can, and it'll be all the information you need on there. You could call. We can also help you also apply for IHSS or the community-based program. In Texas, it's not called IHSS, it's called something else, but it's the community-based program. So thank you so much for tuning in, and we'll do the other audio on how you can apply if you cannot afford home care, how you can get home care coverage or service and offer it to your low-income clients in Texas. So we'll tell you how to become licensed for that in the next video. This video right here is only to help you get a non-medical home care agency. And where you go to apply for it and everything will be in the notes. Thank you so much. Have a great week.